thank you. Thank you for coming out today. My name is Shelly. I am one of the co-founders and the vice president. I'll be one of your facilitators today, along with the amazing Pam. Who some of you also know is a health educator. How many of you have been to our classes, to workshops? So Pam is also a registered nurse, which I know most of you know. So she's going to be facilitating both of the workshops. But this would not have been possible without the wonderful support that we have here at Arisha. So let me just introduce a couple of those other people. We have Martha, who's going to be on the camera live streaming. She is our treasurer. We have Sheila, who is our secretary. And of course, we have Pascal, who is the president. I know, see, I did a laugh just in case. All right, well, today, the reason we're here is to talk about breast and colorectal cancer. We understand every month it's highlighted, but we know the disease doesn't depend on what month it is, right? And a lot of times they throw information at us and we don't get it. So Hunter College has sponsored us to do this workshop, these two workshops, where we actually give you the information and give you an opportunity to ask questions. And it's presented by someone who knows what you're talking about. Okay? So that's what we're going to talk about today. We're going to talk about breast cancer, colorectal cancer, and then after our little break and bingo game and food, bingo. We got stuff for y'all today. Bingo. And we're going to talk about genetic testing. So that's just a little bit of an overview of what we're going to do. But the first thing I want you to do, since we're going to be here for a little while, I want you to turn to the person next to you and go, "Hi, my name is." Hi.
Hello, Margie. Hi, Donna. I'm Pam. Yes.
And it's important that we know the person next to us, right? This is a safe space. We want to have an open, honest conversation. Yes, we understand it's going to be live streamed for people who unfortunately weren't able to make it, but we really want to share information when we want you to feel safe speaking. That's fair? And if you don't want to be on camera for any reason, just be like, "I'm going to say something. I don't want to be on camera." You know, we see it all the time on the news. So, with that said, in front of you was a like you to do if you haven't done so already, please take a second and fill out the pre-survey. The post-survey, we're going to do at the end. Okay? Everybody get a chance to do that? Yes. Okay. And just to give you an idea of why you're here, there's a little consent form that you didn't have to sign, but we just want to make sure you're aware of. As I said before, this is being presented by Hunter College. So this is a little different than our regular workshop where we just give out information. Here, this is part of a research study. So that's why we're asking for the pre-survey, and then we're going to have you do the post-survey. Because they want to measure, are these workshops effective? Because they need to know if you don't get some information on it, how do they need to change it? Okay? So once you complete the pre and the post and you submit it, then we got a little gift for you. That's not in, it's not like we're bribing you, but we're just saying, you do the pre and the post, you have it. So just to be clear, I want to make sure that you know that this is a research project. And if you have any questions about, well, who can I talk to about that information, let us know and we'll give you their email address. And why is it done? Because our community is being impacted by cancer the most. So we think it's really important that we bring this information to you, and then you take it back to your friends and your family, because we don't want it to stay in here, right? All right. So the research, what they're calling the workshops, are going to be a little bit less than the second one. And like I said, there's food and games in between, because you know how we roll, right? And could this research be bad for you? Is there anything bad for you? We don't think so. We think it's all good information. All right? And then what happens to the information? They're going to take a look at it, collect it, and then report back on it in terms of how our community is being impacted. All right, anyone have any questions about that? Anybody wants to leave now? Okay, just checking. Because if you leave, there's no food in there. Just be busy. All right, so as I said, we're going to have a great workshop for you today. We have a lot of information. But first, before we do this, I want you to clap once if you know someone that you have to remind to go to the doctor. I want you to clap twice if you've ever had a health scare. Clap 3 times if you know your complete family history. Yes.
Yes.
I couldn't clap. My mom was always hiding something from me. She talked something with the helmet. I'm like, what's that? What did you tell me? She's like, yeah. All right. Number 4. If you've ever been afraid to go to the doctor to be tested, clap 5 times. So we had different people clapping for different reasons, right? So today, the most important goal of today is to demystify the testing and why we need it and the symptoms so that when you see them, you don't ignore them. Okay? Now, for the last one, can you clap 5 times if you're happy to be here? Yay! I'm not going to shout anybody out, but one person didn't clap. All right. So with that said, I am going to turn it over to the amazing Pam Wilkinson, our health educator, registered nurse, who is going to present today's workshop.
Well, thank you, Shelley, for that great introduction. Okay. I am Pam Wilkerson. I'm a health educator and I'm a registered nurse. I've been a registered nurse for over 30 years. And I truly believe that my higher upper, he wants me to share all this wisdom and knowledge that I have obtained. So that's why I'm here today. Okay. And hopefully all what I tell you or something, you can also go out and share it with your loved ones and friends and family members. Okay. So we're beginning today with breast cancer. What is the goal? The goal of today's workshop. I'm gonna have to turn that down. That's the goal, to be happy and dance too. Okay, when you obtain the information. That's the goal. What are the goals? Okay, so what is colorectal and breast cancer? And what are the major risk factors of colorectal and breast cancer? What can we do to lower our risks of getting colorectal and breast cancer? When do you get screened for colorectal and breast cancer? And your lifestyle changes on how to lower your risks of colorectal and breast cancer and improve your health. Okay, so these are our goals for today. So with colon cancer, okay, first of all, we know that there is lots of cancer. Okay, cancer runs throughout the body. Okay, but today we are focusing on these two, but I will be speaking about some of the other ones too. Okay, who can tell me what's the number one leading cancer right now? Anybody? It's lung cancer. Okay, lung cancer comes number one, basically. Okay, and which is the cancer? Can anyone tell me that's not easy? You cannot detect it. Pancreatic cancer. Okay. Okay, there was one point in time that I thought that that was the number one, but it's just because it's the deadliest, pretty much. Okay, because they cannot really detect pancreatic cancer, and it lies straight back in the abdomen. So we're going to start with the colon cancer today. Colorectal cancer begins when healthy cells in the colon or the rectum, they develop mutations, that's changes in their DNA. We get our DNA from our parents, and we're going to go further this afternoon with, or after this workshop, with genetic testing. So I'll speak a little bit more about it then, the DNA. The colon is part of the digestive system. So it includes the small intestines, the large intestines, and the rectum. Who can tell me, out of the small and the large, which one is the longest? The small intestines. Many people think it's the large, okay, but it is the small intestines. Okay, cancer that begins in the colon or the rectum is called colorectal cancer. And for breast cancer, it's a disease in which cells in the breast, they grow out of control. The kind of breast cancer depends on which cells in the breast. turn into cancer. So we have lobules, we have lobes, we have ducts, we have different areas that are named in the breast. So it depends on what area. That's what the cancer is named. Most breast cancers begin in the duct or the lobules. And breast cancer can spread outside the breast through blood vessels and lymph vessels. And when that breast cancer spreads to other parts of the body, we say that it has metastasized. Okay, and of course, that's something that you're really, it can really attack every organ in the body once it starts metastasizing. Okay, so how does colorectal cancer start? So most colorectal starts as a growth on the inner lining of the colon or the rectum. Okay, and these growths are called polyps. Now, when you go and you get your colonoscopy, they can discover whether or not you have a polyp. What is a polyp? It's an abnormal tissue growth that's on the mucus line, the lining of the colon or the rectum. And over time, some polyps can develop into cancer. Many people with polyps or colorectal cancer, they do not have any symptoms. And see, that's another thing. You're walking around, you're thinking you're fine, okay, until some symptom happens, and then not necessarily will any symptoms happen. So this is very important. It's very important. Why it's very important for you to get your physicals. Okay, get a physical yearly to see what's going on. Okay, also polyps, I just want to state that they can grow into like great clusters, okay, or they can be flat. Okay, a lot of times we see them where they are, if you've ever seen a picture of a polyp, okay, where they're hanging. Okay, they're hanging on that line. But they can be flat and raised also. Okay, so, that's okay. How does the breast cancer start? So breast cancer occurs when some breast cells begin to grow abnormally. And I mean the cancer cells, they grow rapidly too, most of the time. These cells divide more rapidly than healthy cells do and continue to accumulate, forming a lump or a mass. The cells may spread, as we said, metastasize through your breast to your lymph nodes or to other parts of your body. Who can tell me what a lymph node is? Anyone knows what the purpose is?
Your lymphatic system, it collects your, when you're sick, like it collects bacteria stuff, and like it's like a deposit of what it's collected.
So it filters the garbage. That's right, within your body, and we have lymph nodes all through our body. Okay, starting from the side of the neck all the way down. Okay, so excuse me, that's in the lymphatic system, the immune or the lymphatic system. So breast cancer may often begin with cells in the milk-producing ducts, okay, which we call that invasive ductal carcinoma. Breast cancer may also begin in the glandular tissue, which we call them lobules, invasive lobular carcinoma, or in other cells or tissues within the breast. And as you see here, they're showing you the milk ducts. Okay, this is a normal duct. This duct has carcinoma in it. And this is invasive. It had really went in. Ductal carcinoma. Now, men can get breast cancer too, if no one knows that. Okay, and the cancer, where it is formed in, is behind the nipple. Okay, behind the nipple or around the areola of the nipple. Okay, many people, many men, year by year, we have quite a few that pass away from breast cancer as well.
So no purple nipples.
Excuse me? You said don't pinch the nipple? Okay.
You see the guys go like that.
Don't pinch the nipple, but then I'm gonna tell you, if you are experiencing any symptoms, you won't want nobody to touch the nipple, okay? Like, please don't touch my nipple, okay?
Maybe if they do, go out.
Then you know you need to go. If it's that tender, if it's that, where they can't touch it. So our symptoms of colorectal cancer. First, you might have a ribbon-like stool that comes out, okay, from the rectum, and or rectal bleeding. Either that bleeding will be bright red or it could be a dark red. Now, usually your stools are what we call tarry stools. They're dark. Now, we all know that our stool is brown in color, and some people's is a little bit lighter than others, but this will be like black, okay? If you should see black stool, you need to go to your physician and see what's going on.
So look at your poop.
Excuse me?
Look at your poop.
Yeah, listen, it's very important for you to look at your poop. Okay, there's even with poop, whether it sinks to the bottom or whether it comes up at the top, something's going on in your system. Yes, Latoya. The iron, yes, it will. It will. Now, see, that's something that you have to consider too. If I'm on iron, that it will change the color, okay, of the stool. But hopefully that even with the color, then maybe you'll have the other symptom of maybe you see redness in the water because you're bleeding slightly, okay? And we have what we call tenesmus, which is the feeling that you have to empty your bowel. But when you go there, and I know sometimes people probably have experienced this though, you feel like you got to go to the bathroom, you sit on a stool, you even feel like you passed something, but it's gas, really. Okay, and you look in the stool behind you and you don't see nothing. But you also feel a lot more empty once you sat in there and let it out. But with this, if this is something that is happening quite often, then you need to go check it out and see. We also have anemia, which is caused by iron deficiency. And at that time, you will be given the iron pills to take. Now, there's different forms of iron pills if no one knows. That some go through the system very, very quickly, and they will help you move your stool. And then some people also with certain ones, it will bind them, okay? It will bind them. And then that's when the doctor will give you a stool softener to help you go to the bathroom. Persistent abdominal pain or unexplained weight loss. Now, of course, we all like to see that scale where we get on in it and say, whoo, this morning or yesterday, your last month I was 154. Today I'm 145. But something is going on. Why are you losing weight that quickly from month to month? Especially if you didn't walk nowhere, didn't do no exercises, didn't come to line dance here, Larissa. Okay, you're not losing them pounds like that quick. There is no way. Okay, you can. Okay, our symptoms for breast cancer now. Hey, so women, please examine your breasts. Okay, that means every time you're in that shower, you need to be doing a self-examination. Put soap on the breasts. Run it from even the armpits all the way down, even from the collarbone, right? Because you don't know where those tumors are. And press. Do not be afraid of touching yourself, please. Okay? Yes, I teach and I have some young students and they're like, oh. Is this not your body? Okay? It's your body. You need to examine yourself. So some of the symptoms, constant breast or nipple pain. We're not talking about just an occasional pain. Like a lot of times when you're ovulating, your breasts become very tender. Okay, but when ovulation takes place, then you're okay again. So we're not talking about that. We're talking about constant pain. Okay, I've ovulated, I've had my cycle, and my breasts still hurt. You need to go see about it. Okay, the nipple is inverted. It's turned inward. Okay, now especially if you don't have that normally. Okay, you've always had where your nipples were out. Okay, and for many of us women, of course, who breastfed our children, that nipple was out. Of course, if you have an inverted nipple, it's hard for you to breastfeed also. And that's why a lot of our mothers, we can't look down on them, okay, because it's not their fault. Lots of times they really want to do it, but they can't because of the inverted nipple. And you have a rash or a color on the skin around the nipple. A change in the size or the shape. Now, please look in the mirror. Not just be in the shower and feel, but look in the mirror and see. Okay, is one looking larger than the other? Is one, is one falling, slouching than the other? Is one standing up and the other one is not? Okay, Latoya, you checking it out now. Okay. But check your size and your shape. Okay. Then dimpling or a change in the skin texture. Now, normally our breast is smooth. It's smooth. You start feeling it, and you got this rash all around it. What is going on? That's not normal. That's not normal at all. So why should you ignore it? Okay. And again, as we spoke about with the clapping, a lot of people are afraid to go because they don't know what the diagnosis will be. But there's different stages of breast cancer. Okay, so, and the earlier they catch it, the earlier they can treat it. Okay, so please don't wait. Next is lump or thickening in the breast or the underarm. And see, this is why it's important for you to lift up in that axillary area. Check it. Check it, please. Okay, swelling of all or part of the breast area. And then unusual discharge. Now, no one should be having discharge from out their breasts. You're not feeding a baby. And that's not even discharge. That's milk when you're feeding a baby. It would be clear liquid or it would be white, of course. But now we're past childbearing age. We're past childbearing age. Why should you be getting some sort of discharge coming from your nipples and that you don't go and see about it? Okay, with men, again, they don't have so much glandular tissue. It's up against them. But they do have symptoms too. You have a lump. Go around the areola. Feel. Feel for a lump. Feel up on the breast. Nipple discharge as well. Reddening. You have an inversion also of the nipple. And the skin could dimple. So, just like a dimple on your cheek, you should not have a dimple in your breast. Okay, not at all. Okay, we're going to do a little true or false right now.
Yes. Before we do that, I forgot to mention this in the beginning. The bathroom is available. We have the door closed because if you were at the last workshop, all you heard was a toilet flushing. So if you go inside, the door will be closed. Just knock and we'll open it up so you can get out. Sorry.
No, that's okay. That's okay.
Or if we don't hear you, text someone who's here.
Before we go into the true or false, I just want to say about dense tissue. Women who go and get their mammograms done, dense tissue, it prevents them from seeing where that tumor is. Okay, it's kind of hard for them to see. So that's why hopefully all the other stuff that you've done or looked at and felt and stuff, of course, that will help them. But they do have a 3D mammography test now. The insurance company, it probably costs a little bit more, but of course, it's worth it. Again, with the stages, if we catch it early, they can treat it, and it be successful. So, a true or false?
And raise your hand.
Raise your hand. Right, you may get a gift or a token. So, Blacks or African Americans, they're about 20% more likely to get colorectal cancer. Who can tell me if that's true or false? Raise your hand. You're absolutely right.
All right.
Okay.
We have a gift for you.
We have a gift for you.
All right. True.
The next one, colorectal and breast cancer are decreasing amongst young people. What'd you say? No? Okay. Kelly, you want to get hurt. Okay. Next, the kind of cancer, it depends on which cells in the breast turn into cancer. Sharon? Yes, most certainly. And the last one, the colon, is part of the urinary system. It's part of the urinary system. False. Well, you make it get some lip wrong. That was a collective one. Okay? Now, it's very important for us to know our parts of systems, too. I'm going to just say that because I have come upon many people that don't know their systems. Okay? And I say to them, you have every system. So even if someone is talking about their system, think about it. You got that system too. Okay? You have that system. So in this, with the digestive system, please take notice. Take notice to the stool, especially. Take notice to the pain that you feel, perhaps after you eat or if you haven't eaten. Okay? There are various diseases in the colon, right? Inflammatory bowel disease, okay? Crohn's disease, okay? We also have colitis, okay? Which, as I teach, if you know how to break up a word, you will be able to figure it out yourself. Tis is inflammation or swelling. So when we say colitis, inflammation of the colon, okay? It's some swelling going on in that colon. Okay, so these symptoms we're going to break for a second. No? You want to continue going? Okay then. Okay then. So next, yeah, because just did the force. You can turn. Why should you care about colorectal and breast cancer? Why?
Because it'll kill you.
You are absolutely right. And if it doesn't kill you, I'm sure it's going to make you very uncomfortable. That's not the quality of life that you should have. That my abdomen is distended and my abdomen is hurting me every morning I get up, okay? And I'm passing a lot of gas, even if you're passing a lot of gas. A lot of people ignore that too, you know? A lot of flatulence. They say, oh, I ate, or I didn't eat, or I this, or I drank milk, or I this. Listen, you passing gas just like you burping. Now, people don't realize that too. It's coming up the other way. Okay? I experienced being around someone that, like, they're burping every 10 minutes. What is that? You need to go and see what's going on there. Okay, so with this chart, statistics. Okay, we see for males with colon and rectal cancer, it's number 3 in new cases. And then for the colorectal in death rate, it comes to number 3 too on the chart. Now you see the other cancers that are above it. Again, as I said, there is a lot of cancers. There is a lot. And by you going to the doctor, of course, and having your physicals, they can identify which cancer you're dealing with and treat it. Next, for breast cancer, it's number 1 in new cases. Again, because people are ignoring them. And when they get to the doctor, they're at stage 2 or they're at stage 4. Okay, now if no one knows, the cancer can go into remission. Okay, with you taking the different therapies, radiation therapy, chemotherapy, they might have even done some hormone therapy, and they might have done some surgery. And that cancer can go into remission for a year, for 2 years. But normally, unfortunately, if it comes back stronger than ever before. Stronger than ever before. Okay. But it's wonderful that our medical field has found ways to help you to continue to live a better quality of life for yourself too. Okay. So next, so the female with the number 1 in new cases, but the colon and the rectal cancer is number 3 in new cases. And then for the females, as far as death rates, it's a pretty high death rate for breast cancer at number 2. It's a very high death rate. And for the colon and the rectal cancer in females, it's number 4. It ranks number 4. Okay. So colorectal and breast cancer rates are rising amongst young people. Definitely rising. And it says rising colorectal cancer incidence has rapidly shifted mortality patterns in adults under 50 years of age. The colorectal cancer has moved up from being the 4th leading cause of cancer death in both younger men and women. 2 decades ago, the 1st in men and 2nd in women. Who could say why? Who would think why? Excuse me? Ultra processed foods. That's one. Screenings, number 1. Young people don't go to the doctor sometimes. They like, what? I don't have time. I don't have time to go. But you have to make the time. Hey? Now, breast cancer, it leads in women under 50 with 2,251 deaths in 2021. Now, we're in 2026, so you know, it's rising, rising, rising as we continue to go within the years. One second. Colorectal cancer is the 3rd most commonly diagnosed cancer among both men and women. And since 1975, our colorectal rates have decreased for those over age 50 and increased for those under age 50. You know, when we know better, we should do better, okay? And it seems like as we get older, we become more aware of things. And it may be that we even become more responsible now because we're looking at our bodies more than we did when we were young. We'd be like, okay, something ain't right here now. So is that to say that as we get older, we get a little bit more nervous and paranoid about things? Maybe so, but it's in a good way because at least you know you'll be at that doctor's office. You'll be calling him to make an appointment. Okay, so 135 in 2017, 135,500 new cases of colorectal cancer, and 13,500 was under the age of 50. So 1 out of every 10 people are diagnosed. They will be under the age of 50 years old. Okay? I need you to turn. Yes.
The part that maybe that insurance doesn't cover the cost of it, and they just recently, I think, made the screening age 45.
Right. And we were going to talk about that a little bit too. But yes, the screenings that they have, the age for some of these things, 40 for breast cancer and 45 for colorectal cancer. I mean, I kind of really don't agree, but this is the American Cancer Society, and they have put those ages on it. However, I think if you know, this is why it's very important to know your family history. We'll talk about it. If you know that there's someone in your family that has had colorectal cancer, has had breast cancer, then I would definitely ask my doctor. And if that doctor doesn't do, kind of move on, you know, and get a doctor that will do, okay? Because that is, excuse me, we do hear that young people are passing from breast cancer in their 30s, in their 20s, 29. Okay, so they should have been screened. They should have been screened. That is something that, yeah, we worry about. So now the disparities. We're talking about Black African Americans now, us, people of color. Okay, you have the highest rate in colorectal cancer of new cases and death rates for the colorectal cancer of any ethnic group in the United States. Now, see, and a lot of that too, well, some of that may contribute. Low income, we all know. Economic status, neighborhoods, you know. Is the clinic open here? Are they taking me as a walk-in? Will they bill me for this test? Or do I have to have the money? Do I have insurance? That's our biggest thing. Do I have insurance? And you spoke about the insurance. Usually if the doctor has also, recommended they get screened further, the insurance company should not reject it. They are supposed to go ahead and let them have the test done. But all of these things in our neighborhoods. Okay. And sometimes, of course, in our families, we see the older adults not going to the doctor. These are the people that raised us. And I think you mentioned, Sharon, or someone mentioned about, no, it was you, I'm sorry, that spoke about they don't tell you. Family members don't tell you. Okay? So mom's keeping everything secret. She's going to the doctor, twice a month or whatever. When you're at work, she going to the doctor. She coming home and she ain't mentioning nothing. You say, "How was my day?" She say, "Oh, it was good. It was good." Okay, that's terrible because you need to know. Okay, y'all share that DNA. You need to know. Okay, so African Americans are 2 times more likely to be diagnosed with colorectal cancer before the age of 50. African Americans are about 20% more likely to get colorectal cancer and about 40% more likely to die from it than most other groups. Now, again, what I spoke about, they didn't go to the doctor. They never got a treatment for it. So they wind up passing away with that diagnosis. Hey, Black men and women are more likely to get colorectal cancer than any other racial or ethnic group in the community. Now, in breast cancer, our women, Black women, still have a 4% lower incident rate of breast cancer than white women, but a 40% higher breast cancer death rate. And we know that. Years ago, we all know that it was more prevalent in the white race, and it still is. They're saying it still is. But it doesn't discriminate. It's like, okay, no, I like you too. You too. Okay? It doesn't discriminate. Then Black women have the highest rate of death from breast cancer than all other women. It's the second leading cause of cancer death after lung cancer. As I said, it's the first in women in the U.S. overall, but it's the leading cause of cancer death in Black women. And breast cancer, incident rates were 52% higher in Black men than in white men. Now, again, we all know, does that husband go to the doctor? How many times you got to tell him? I made an appointment. Oh, you see, she said you got to steer him down. Okay, got to steer him down. And then you made an appointment for him, and then he says to you, "Oh, I got something to do that day. I got something to do that day." Okay, and every day she said, "I don't think so." I know that's right. Okay, get them to the doctor because most of the time men definitely don't. Once they get there, it has already staged. It has already staged. Second stage, third stage. Okay, and we all know that the medication and the therapies is not going to work as effectively as it would have if you would have got there first. Okay. Okay. I figured that, though. I figured that. Okay. How much more time? Okay. About 20? Okay, Asians. We're going to just go a little bit with the Asians. Okay, that community. We're going to be, it's the most powerful ways to prevent regular screening. That's why screening is so important. So they have the lowest rate of colorectal cancer in the United States, but 52% of them haven't been screened. So that's half. They ain't going to the doctor either. Okay. Although the colorectal is the third most common cancer in the United States, it is the second most for the Asians. Okay, the breast cancer, we all know they're more likely to be diagnosed with a local breast cancer than Blacks. This is the Asians and the whites and the Pacific Islanders. And it's the second leading cause of death after lung cancer. Okay. Then we've also talked about Hispanics, which that's very important. You know, in our community, it is. Again, regular screening, must get it done. 47% of Hispanic American adults have not been screened. That's almost half. And the Latinos are more likely to be diagnosed with colorectal cancer at later stages. Again, because they didn't go early. Breast cancer is the leading cause of cancer death in Blacks and in Hispanics. And the Hispanic women are 30% less likely to be diagnosed with breast cancer than non-Hispanic white women. The Hispanic women are more likely to be diagnosed at a younger age and with more aggressive disease. Now, have anyone heard of triple negative breast cancer? That's a very aggressive one. It's a very aggressive cancer because what they treat it with, it doesn't respond sometimes, okay, to the estrogen and the progesterone levels. And it's diagnosed at a more advanced stage. So, risk factors. These are the risk factors. It's anything that increases your chances of developing a disease. And some risk factors you can control and some you can't. Okay, you can't. So your protective factors, they may lower your risk, but it does not mean that you will not get the cancer. So who can tell me some risk factors quickly with colorectal? Do you know any risk factors with colorectal cancer or breast cancer? What's a risk factor?
A family member had it?
Family member had it, okay.
Poor diet?
Poor diet, yes. The age, your age with breast cancer, your age, the family history, your gender, of course, the females have it more, okay. That breast tissue being so dense, that dense breast tissue. Obesity, okay, when you're big also, you're more susceptible, okay. It increases into the estrogen levels. And drinking, this is all for breast cancer here, okay. Then colorectal, the same thing, old age, but now they threw in the other, that processed meat. We all say now, we don't know sometimes what we eat. No, we don't know. Okay, alcohol intake, low intake of plant-based ingredients. Many people don't eat vegetables. Many people don't eat vegetables. High body fat and obesity. Genetics plays a big part, of course. Previous history with colorectal. Is okay? You got it? Okay, wait a minute now. Oh, listen. Okay, come on. Our only male. Yeah, when that happened. Okay, it's all right. You're gonna switch it. Bro, thank you. Yes, we need you. What you said to Okay, you want me to jump?
Yeah, just summarize as much as we can, because we have probably like 15 minutes. So
Okay,
I just hit like the important parts. Yeah.
Okay. Yes, we good? Our only male here. We gotta keep you here. We gotta keep you safe now. We don't want you to have to leave out of here and go to the doctor. Not at all. Okay. So history with colorectal cancer, when you have some problems with your colon, okay? Like I said, Crohn's, colitis, inflammatory, and diabetes, type 2. Diabetes affects everything, and people don't realize that. And the male gender now is more the male gender with the colorectal cancer. Okay, now these are what you can't control. We can't control getting older. We can stop. I want to stay at 35. Yeah, no. Okay, and family or personal history of polyps. Okay, and genetics. Okay, you can't change that. You have that DNA from mom and dad. Okay, with breast cancer, age over 40 because you're getting older. Personal health history, family health history, certain genome changes. Okay, that's that DNA. Okay, it's making changes in it. And radiation therapy. Okay, radiation therapy, we all know, it will harm the good cells as well as the bad cells. Hey, and then eventually, eventually with the radiation, with them harming the bad cells, the good cells, eventually they may turn cancerous too. Okay. Next, hereditary and cancer. Does my family history increase my chances? Okay, yes, it does. That's why it's important for you to know your history. Okay, so hereditary and cancer. For colorectal cancer, most colorectal cancers are found in people without a family history of colorectal cancer, but 1 in every 3 person, it is due to a family member. And for breast cancer, 5% to 10%. Now, again, like I said, the genes, they played a big part because if you have a change in your genes, okay, colorectal is one of the most common tumors, and genetic predisposition is one of the key risk factors in the development of this malignancy. Okay, you can turn there. So these are the things you can control. Now we all know. Don't stay home and be a couch potato, please. Okay, you got to get up and exercise. You got to walk, circulation. Yes, come to Arisha and line dance. I'm going to tell you, you won't be able to sit down. You won't be able. Okay, even Zumba class. Okay, so these you can control. Your diet, what you put in your mouth. Okay, your lack of exercise, your weight, being overweight or obese. Now that's a hard one too, but it can be done. Okay, Weight Watchers, getting with friends, walking, smoking, heavy alcohol use, decreased estrogen exposure. Okay, that attributes to breast cancer. Preventive mastectomy. Now, sometimes women, yes, they remove their breasts because they know that it's a history in their family. And preventive removal of your ovaries too. Okay, those you can control. Go ahead. Now, there was a big gap during COVID with people screening. Nobody was coming out the house. So if they had a screening date for a mammogram or anything, they was canceling. So as it says, as the coronavirus pandemic is raised in 2020, the number of people getting screened for cancer in the United States dropped dramatically. So they reported in the past year for breast cancer or cervical cancer screening, it dropped by 2.13 million. That's a lot of people, 6%, respectively in 2020 compared to 2018. And between 2018 and 2020, the colonoscopies for colorectal cancer detection in the past year, they dropped also by 16% for both men and women, but was offset in an increase in stool testing. Now, they want to do the quick one, okay? There's no Cologuard when you have on TV, the stool, okay? He's Cologuard. Okay? But we'll talk quick. It's another slide about those things. Screening helps the doctors find the cancer. And the treatment is more likely to work well when the cancer is found early. We know early detection, the survival rates. You'll last longer, of course, than as opposed to coming in when it's at stage 3, and stage 1. And the screening before the symptoms appear is best. Okay, here's our screening. Like I said, 45, but they do it all the way to 75. With the breast cancer, they stop. They start at 40. They don't go to 75 because they figure they don't want anybody older coming in there. But no, they still can get cancer. Okay? Yes. Okay. So here are some of the screenings. You have your fecal blood they take from the stool. Okay, here's good old Cologuard. Now this is done every year, the blood test. Cologuard is done every 3 years. And that's all you depend on, Cologuard? In those 3 years. Okay, sigmoidoscopy. In the large intestines, there's different parts of the large intestines. So in the sigmoid part, they do a colonoscopy and look in that area because it seems like that's more prevalent. It goes in that area. But every 5 years. And then a colonoscopy every 10 years. Some places will say 8. Doctors will say 8 years as opposed to 10. But all of this is important. Your mammograms, we all spoke about that. The mammogram, definitely, please, yearly, yearly. And they said, I looked at the American Cancer Association yesterday, and they were saying that, you know, you can choose at 50 whether you want to go every year, but that you should go every 2 years. But listen, go every year. Okay? I think that it's best that you would go every year, especially if you have history in the family, most definitely. So the clinical breast examination, we went over the size of the breast. Again, it's just mentioning that, comparing the size, the shape, the texture, all of that, and definitely the nipple for any fluid coming out of. Okay, here's our stages. Look at that. This is a polyps. Okay, so this is the stages of the 5-year survival rate. You catch that polyp from that colonoscopy. Definitely. They can remove that polyp. They can biopsy that polyp to see that it's malignant or it's benign, cancerous or not. Stage 1 is at 90%. Stage 2, 55 to 80%. Stage 3, 40%. And look at that. Stage 5, 14%. Okay, that's good that it did go down, but it's, again, important catch. This is a 5-year survival rate of you surviving. 40%, this is less chance, of course, at 14% of you surviving over the 5-year period. Okay, and here is the 5-year relative survival rate for the breast cancer, depending on where the tissue is, whether the cancer is. It's localized. 5 years, 99%. Go in, get it diagnosed. Regional, 86%. Distal, 30%. So localized, there's no sign that the cancer has spread outside of the breast. That's the best time to catch it, of course. You don't want it to have metastasized. Regional, the cancer is spread outside the breast to nearby structures, or the lymph nodes now. And distal, it spread to distal parts, even your lungs, your liver, or your bones. And once bone cancer also. Listen, we got 206 bones in our body. We need our bones, every one of them. Okay. Okay, you can change. So what else can I do to lower the risk? Well, we all know the exercise and the eating. If you cannot run, walk. Walking is so important. Yes, Arisha? Yes, that's Teresa there. Come with Teresa Saturday morning, and she'll walk you 2 miles, 3 miles. Okay? 30 minutes a day, 150 minutes. Eat a healthy diet, and definitely limit your or reduce your alcohol drinks. Okay? To find a cancer screening near you, I have put on the table Montefiore, Lenox Hill Radiology, right here on Fordham. They build a new place. Okay? They're all over. They are all over. And so, please, it is important. Even Sloan Kettering, they do screenings too. Actually, I tested by calling them because I wanted to know for y'all if they needed a referral from your doctor. So first to go to Sloan Kettering. If no one knows where Sloan Kettering is, right over on Eastchester Road. But they have different locations, of course. Bronx Care, what used to be Bronx Lebanon, okay, and St. Barnabas Health System. They're known. These are some places that you could go for screening. Okay, any questions? We are running a little, but we're good right this moment. So I'll work up the wrap up. These are questions that you definitely should ask your doctor. And if you think of even more, you need to write them down before you go to the doctor. We all have a tendency of that when we're in the doctor's office, we forget everything. We forget everything. I think that white coat. Have anybody heard of the white coat syndrome?
Yeah.
Yes, yes. You get in there, your pressure go up. You be a little demented. You done forgot. You done forgot what I had to ask. Oh, shucks. And then you get to the train station and you say, oh, shucks, I didn't ask him this. I didn't ask him this. But here are some of the questions. What breast cancer or colon cancer screening test do you recommend for me? At my age, because of my history, what? How often should I be screened? If a problem is found, what will we do next? And you should have a doctor that's going to talk to you. That not for 2 minutes. and say, okay, Miss Jones, I got another patient coming in. No, you got to speak with me, please. What are the risks and the benefits of cancer screening? Am I at a higher risk of breast cancer or colorectal cancer? If so, do I need special screening tests, or do I need to be screened more often? Do you have everything you need to estimate my risk? Does my insurance cover my cancer screening? And that's very important. If your doctor doesn't recommend mammograms at this point and you're under age 40, ask, when should I start getting screened for cancer? And like I said, if you don't like the answer that he gives you, basically, you can see he or she, you are absolutely right. We have so many doctors out here. So many. Okay. If your doctor doesn't recommend the mammograms at this point and you're in your 40s, you say, can we discuss the benefits or risks of getting screened for cancer? Hey, nowadays, we know that doctors see a lot of patients, okay? But it's only one you, and you are special, okay? And treat yourself like you're special. I need to find out about this. I need to go get tested. So please, is there any questions that anyone has about colorectal or breast cancer before we close up?
Does diverticulitis increase colorectal cancer?
Yes, it does. Yes, it does. It's another digestive disease. Okay, you have diverticulitis and you have diverticulosis. The litis is more severe. You have more episodes with the losis. I mean the litis, excuse me, the inflammation. Okay. Okay. Right. Yeah. One has more. One is when you have more episodes. Yeah. Basically, you have more episodes. Okay. And the lining is affected more than in the losis. Okay.
Can we give Pam a round of applause?
Thank you. I thank you all for coming out.
And you're gonna get her another one with her in a few minutes, right? So what are some takeaways? Give me 3 takeaways. What are you gonna take away from this workshop?
You got all your screening.
Early screening.
Advocate for more information about that.
Yes. Well, that's good.
You can be an advocate for yourself. And that's the most important part of this workshop. We want to give you the information, and then you can advocate for yourself. And we hear a lot about that whole white coat syndrome. I go in with a list. I'm like,
that's what you should do.
Yeah. Because that's the reason you get in there, you know what you want to say, and the doctor might take it in another direction, and you're focused on this and not on this. So make sure you come prepared. Okay. And so with that said, we have a couple things. Please take a second right now to do the post survey.
Beautiful. What we got here? The raffle. Mm-hmm.
Yes. So you're going to leave it on the table. They're going to collect it. And then while you're sitting there, we'll give you your gift that you get. First the ditty.
No, Shelly, you have the gift, right? You have the gifts. She said, what's the gift?
Oh, I have them in my hand.
You got it. She got them in her hand. Mm-hmm.
Oh, yeah. Mm-hmm. Yes. And then, we got a little raffle. I don't think we talked about the raffle.
Mm-mm.
No, we got a little raffle. And then I'll talk about your pictures. Once this is done, we're actually going to have call table by table so that you can go up and eat. We are going to play a bingo game in between while you're eating, and then we're going to start up that next workshop about 12 to 5.
Yeah, anybody need help with the pros? What's the post survey?
If there's anything that wasn't discussed, you can edit.
Mm-hmm.
Look at your number and remember your number. Before you select that. So they have numbers.
Yes.
Okay. Yes. All right, so we have 2 raffles that we're going to do. Pam is going to pull out a number First one.
22.
22.
22. Yes.
$25 gift card for you.
Wow.
Yes.
Number's one. Yeah, mine's 16.
Next one.
Number 12. Number 12. Oh, wow. Oh, you won. A $25 gift card. Okay.
So you have another chance. We are going to dump this out, and then you're going to sign it again and do the same thing for the second workshop. So now you know what the prizes are. All right. Yep, we're going to dump it.
Okay.
So we done with the pre-survey, the post pre? All right. So I'm going to do this now. Stand up and look under your chair. Let me know if you see anything. Be careful, don't hit your neighbor in the head.
Yeah.
Well, he broke his.
Oh, right. So it's not under that chair. Anybody see?
All right, we got one. We got another one. All right.
Just check the chairs. Check the chairs. Y'all on that side. Yeah, get it. Get it. Yeah. How many is it? One more?
All right, so we have to go to.
Hold on to it. They're going to get it. Oh, Shelly. She had brought him. She had brought him over. Oh. Okay, that's right. Ain't nobody sitting in that. You sitting in that chair.
Nope, not a t-shirt.
You want to see?
No.
Oh, the back. No, they shouldn't have done. Now you have to.
Okay. You have to post the pre-survey.
Let me take the pre only.
The vote, no.
Oh, you taking both? Okay. Oh, yeah, because it's both for now. Yeah.
All right, once they're done, once you finish your pre and post.
Okay, the pre and post. Yeah. Take them. Thank you. Okay then. Okay then. I'm sorry. Okay, I put them in order though. I got 5. I got 4.
Margie, me, and
Oh, you wanted the name? Oh, okay. Go ahead. Go ahead.
If your survey was selected,
Okay then. Yes. Yes, you can start the pre. You can start the pre. So you can start the pre. I know. They're collecting it. They don't want me to collect it. Listen. Have our beautiful sandwiches today. How you doing? I'm good. How you? Good, good. I love that hair all the time. Beautiful. It looks so pretty on you. Oh, we have someone else coming in? You have to come and register. How are you this afternoon? Are you coming in for this? Okay. Okay. You want to come to the desk? Yeah.
Hello.
Hello. Pascal?
If Sharon had told me earlier,
Yeah. Mhm.
I would have been coming in. I wish I could come in.
Oh, okay.
get up eating. As long as you're paying attention, you can get seconds. All right. And I'll turn it over to Pamela.
Okay, again, we thank Hunter College for sponsoring this and having us release this information. So now we've done colorectal, like she said.
One second, sorry. And this is also a research project, so the waiver that I read from the first one applies here too. Anyone have a problem with that? No? Okay, there we go. I know, right?
And again, it's very important that you do the pre-survey and then the post-survey, please, for us. Okay, so genetic testing for hereditary cancer, what you should know. Okay, when we say hereditary, who can tell me what that means? Yes.
It runs in the family.
It runs in the family. If mama had it, okay, one of the children had it. If daddy had it, one of the children had it. If daddy and mommy have it, then maybe 2 or 3 of the children have it. Okay? So, what is genetic testing? Genetic testing is a broad term. It's broad, it's used, it's wide to describe a medical test that can help explain the cause of a current health problem or provide information on future health risks. Hey, so you may not know now, but if you get that testing done, you'll know for in the future or kind of know, okay? Because nothing is guaranteed, you know that, okay? So testing to learn sex of a pregnancy, you do a genetic testing. Whether someone has sickle cell trait, okay? And whether someone's ancestors, where they come from. Okay, so genetic testing. Sickle cell, the trait. Remember, if anyone knows, you could have the disease or you could have the trait. Okay, what are genes? First of all, we start with our DNA. It's a set of instructions like a recipe for a cake. Now, we all have DNA. You have 50% of your mothers and you have 50% of your dads, but you have DNA there. Or it's like an IKEA manual, which we know those manuals, they got a whole lot of you'd be like, and how to build a chair. Yeah, IKEA got about 60 pieces, okay? But think of that as your DNA, okay? But the genes now is a group of that DNA, inherited information. Okay, so the hereditary cancer genetic testing, this type of testing, it focuses on your genetic risk for cancer that can be passed down in the family. In other words, it's checking whether the genes that are supposed to be protecting you from the cancer, are they working? Hey, this test can tell if someone was born with an increased risk of certain types of cancer. It does not determine if someone currently has cancer. Now, it's like if you have that gene. Parents pass their genetic information down to their children, like their eye color or their hair color. That could be passed down. Increased cancer risk, it can be passed down as well. Okay, so the goals of genetic testing. Definitely, to estimate if you're at risk for getting cancer over your lifetime. Okay, again, because daddy had breast cancer. Okay, he had breast cancer. Okay, or mommy had bladder cancer. Okay, and help explain why someone has cancer. You take the action to catch the cancer early, as we talked about it, or lower your risk. Now, the screening, number one. Okay, so out of every 10 people with cancer, okay, the genetic is just falls 10%. 1 person out of every 10 person. Now, this is familiar. It's still saying this in the family, but when we go into genetic, it goes a little bit more. The familiar is like broad, okay, but then we go into genetic. Yes, hey, this person had it, so we know, okay, that it's in that family too, and you're more prone with the genetic. Okay, see, this one part is more like the environment too, and your lifestyle. So you and someone had a similar lifestyle, okay, or was in the same environment. Okay, you can go. So who should get genetic testing? Our young, the youth. breast cancer, colon cancer, be tested. These are some of the tests, the screening that you should have done for these cancers. Or uterine cancer, if you're under the age of 50. If it's a rare cancer in your family. Ovarian, male breast cancer, or pancreatic cancer. Or multiple people. Multiple cancers in the same person. Definitely you need to have genetic testing. Because you have pancreatic cancer and you have colorectal cancer. Okay? Then family, if it's 3+ family members with the same or related types of cancer. So your sister had breast cancer, you got breast cancer, and your brother got breast cancer. Definitely, you need to be tested genetically. So, for example, a person with both colon, when they say multiple, colon and uterine, and when 3 close relatives, let's say even on mom's side, her sister, 2 of her sisters had breast cancer. Okay? Yes. 2. Excuse me? That's the same thing. It needs to be tested for genetics. But I'm saying, if they had uterine, okay, let's just saying, if they had uterine, this sister had uterine, this sister had pancreatic.
My father's, my whole, everybody in my father's family has cancer.
Right. So I'm saying this still needs to be tested. Okay? It doesn't have to be the same cancer. That's what I'm saying. If this sister got pancreatic, this one got bladder, this one got stomach, and this one got lung. You need to be tested genetically.
Question. Which one are most hereditary? Which cancers are most likely to be hereditary?
Oh, okay. We're on that one. Okay, who can tell me what happened? Share.
See,
What happened? We missed that. Oh, she blamed mama? Mama,
no. Come on, man.
That's what she said. Oh, you told mama that she did the wrong.
Oh, man.
All right now, I know that's right. It ain't coming to this door, mama. Okay? Not at all. So which cancer types, what do you think, which cancer types are most likely to be hereditary? Who can tell me? Which cancer type? Breast, yes. Colon, yes. Which one in types would be most likely to be hereditary? Breast, ovarian, who else? Who? Lung cancer? What other? Anybody else guess? Yes, pancreatic is most likely. Okay, so we have breast, ovarian, prostate. Okay, prostate cancer, colon cancer, uterine. Now, when you hear uterine, and if they say endometrial, it's the same. Okay, uterine cancer and endometrial cancer is the same. Pancreatic cancer and stomach cancer. You can switch. So those are most likely, you see? And this is less likely to be hereditary. Cervical, throat, lung, liver. Now, if you look at this, especially for these 3, throat, lung, and liver, lifestyle. Lifestyle or environment. Is that person, did they drink every morning? Okay. Did they drink alcohol every day? Are they smoking? They've been smoking since they've been 15. And now they're 65, 70, still puffing 2 packs a day. Okay? Look at it. It's the lifestyle and the environment more so. Okay. The BRCA gene. You know BRCA gene. Now, everyone has the BRCA gene. Everyone. Okay? It's a tumor suppressant. Okay? But now, is there any mutation on your BRCA? Okay? Where it had a code, let's say DCDA. Is it switched up? DCBA. Okay? These codes will determine mutations on those genes. Okay, so our BRCA1 and BRCA2 genes, hereditary breast and ovarian cancer syndrome. So 1 out of 400 people have a BRCA-associated increased cancer risk. So it's telling you with this mutation on this gene, okay, for breast cancer, it's more than 60%. That's a lot. For pancreatic cancer, less than 5%. For ovarian cancer, it's 39 to 58%. For uterine cancer, it's possibly increased risk. They don't have a percentage. And prostate, 7 to 26%. Over here, we're talking about the two, because remember, you got two. Okay, and again, you get them from mommy and you get them from daddy. Yes, Latoya.
Okay. What if, okay, I'm not sure if for this, blah, blah, blah. But what if you've been castrated and everything? You still have to go to protection and so forth?
Did you say castorized?
Oh, snips.
Not castorized. That's cows and all of that. Oh, castorized. Okay.
Yeah, we got you.
Wrong word, but I got you. I got you, Latoya. Okay. Okay. We can't have any more children anymore. Okay. You're saying, are you more susceptible? No, you're not out of the clear. No, you're not out of the clear. You're not, especially if someone still had it in your family too, the cancer. Okay, so you're not out of the clear. So for the 2 mutation, this is BRCA2 gene now. Okay, most cancers, again, more than 60% for breast. That's a high amount. Because see, that BRCA is really the breast cancer. Really symbolizes that breast cancer for the BRCA1 and BRCA2. But it doesn't, that's more familiar for the breast cancer, but it does, relate to the other ones too. But less, 5%, 10%, pancreatic, ovarian, 13 to 29%. Now look at this, that's the 2. But remember, the 1 is higher. It's 39 to 58%. And in uterine, the same thing, possibly increased. Your prostate, 19 to 61. So that BRCA2 increased it. Not like the first one. And melanoma, who knows what melanoma is? How's that? Skin cancer. Now, I'm going to say a lot of people of color say now, when I go out to the beach, I don't need no sunscreen on. Please protect your skin. Okay, our sun rays are stronger than ever now. Okay, they're stronger than ever. Yes, our melatonin, we have more than some of the average people, but that doesn't mean. Again, that's another one that don't discriminate. None of them do. They don't. Okay, so. Did we want to go to the 1? It's true or false if you need a break.
We can do true or false. We can do true or
True
false.
or
We
false.
have time.
Okay. I'm going to do a true or false just like I did for the breast cancer and the colorectal cancer. Please raise your hand so we can pick someone so that you can get a prize. Okay. More prizes. Everyone has, and I just need you to don't holler out. Raise your hand. First hand that go up, I'll get you. Everyone has a BRCA1 and a BRCA2. I told you nothing.
And wait to be called on when you answer.
Do it again. Everyone has BRCA1 and BRCA2. Because my eye was that. True? That's true. Okay. Young people under 50 years old who have uterine cancer, they should not get genetic testing. That's false, yes. You should always, okay, regardless of what the age there. Out of 10 people with cancer, 20% is due to genetics. 20% is due to genetics. It's false, 10%. Yes. Okay.
I'll bring it to you, remember.
And the last one. Genetic testing can determine if someone has sickle cell trait. That's true. Okay, so Shelly, you can give her one. And no, here at the desk.
Well,
Okay.
so wasn't there another one? Okay.
Oh, sorry. Right here. Mhm. Okay, thank you. That's a part of making me, letting me know that you're listening. Who's listening? Who's listening? Yes, I'm listening. Okay. You can go to the next slide, Shelley. Okay, Lynch syndrome. Lynch syndrome. Yes, it's a new one, but what it is again that DNA, that gene. Okay, is there some mutations in it? Okay, it's an inherited genetic condition, Lynch syndrome. Yes. And what it does is increase the risk of colorectal cancer, endometrial cancer, and other cancers of people younger than 50. Mhm. So they show you here for the male, more common in the Lynch syndrome is the colorectal, stomach cancer, pancreatic cancer, urinary tract, the cancer in the urinary tract, and prostate cancer. Okay, for the women, it's colorectal, stomach, pancreas, same thing, uterine, but of course our female organs, the ovaries and the uterus. Yes. Okay, so of course they have these genes. Example, like there's one called the MLH1. Like I said, they have all different codes, but it's a mutation on that one. Okay. What family history is important? What's important is what type of cancer did they have? You need to know. You know, sometimes we fill out these forms and they say past history and people just leave them blank. You know, and I say constantly, well, then put that you don't know me. But put something. But this is what should make you be curious. What's in the family? Now, we know back in the days, many, many days, and I'm talking about maybe 60s, 50s, 40s, sometimes your relatives didn't even know what they had. They didn't know what they had. And you say, oh, Auntie died because her stomach was hurting her. And that was it. Yeah, you know, back in, you know, our places where they were born. They didn't have doctors. They didn't have all of these tests. But thank goodness we do today. So take advantage of them. Take advantage. What age were they diagnosed? Okay. What treatment did they need? Did they do surgery? Did they do chemo? Did they do radiation? Did they do hormone therapy? Okay. What did they do? Did they have genetic testing? And a lot of people don't know that genetic testing is available for them. They don't know that. Yes.
So when you go to a doctor and they ask you these questions and you check off that yes, somebody in your family had breast cancer. And I've done that since I was 35. They have never, and I got started at 35 because of family history. So, but no one has ever said to me, you know what, you should probably do genetic testing. And
But that's why I'm here today, and we're here today. But I understand.
on the 14th of this month.
Your mammal.
So should I just say to them, I would like to do genetic testing? Like, how do I?
Yeah. You could say that. I mean, you do the mammal still, of course. But when you go back to get your results to be discussed maybe with your primary or so, yeah, I'm interested in getting genetic testing. Okay. And if not primary, GYN. Okay. Okay. Whatever doctor, but you tell them I'm interested in doing it because it runs so heavy through my family. I want to know where they can indicate the gene. They can indicate and see if there's a mutation on it. Okay, for yourself, and that can help other family members too. Yes, that's right. It starts from you. It starts from you. So the tips: only blood relatives count. The most important family members are those closer to you, your parents, your siblings, your children. So many people do not know the answers to all these questions, and that is okay. That is okay, but it got to start from somewhere. Okay. How do you think genetic testing is done? Who can tell me? Let me see. Blood test? What other way?
A mouth swab.
A mouth swab. Yes, yes. Okay, so when you're getting the mouth swab, mucus up against the mucous membranes, taking off cells. Okay. So, what else in the mouth that they can use? Saliva. Saliva. Absolutely right.
Okay.
As you see, cheek swab, blood drawers, saliva sample. Okay. Yes.
All of them or one?
They usually do either or. They don't do both of them. You know, because maybe the insurance company won't pay for both. They pay for one. Yes. And this, they get the DNA from just that. It's amazing. Your blood, your saliva. Now, if anyone has ever did 23 DNA in me, DNA 23 in me, ancestry.com, okay, my heritage, okay, all of these, they usually ask you for saliva, okay, that you put in a tube and send it. And basically they get it and they test it and bring it back to you, which could kind of show, okay, with your DNA, what you're prone, what's in the family history. Okay, yeah. So now how much does genetic testing cost? But the insurance will usually cover the cost if someone has a concerning personal or family history. They have to. I mean, you wrote on that paper that 2 uncles died from pancreatic cancer and 2 other uncles died from stomach cancer. Okay? This insurance company should definitely, your insurance. For those who do not have insurance coverage for testing, most labs offer the test for $250. $250? Yeah, that's nothing compared to me living. Okay? Now, and I know, it's difficult for some people. I'm going to say that, of course. But, our priorities, sometimes they're in the wrong place. This is one to put in the right place. Okay? Mm-hmm. Then many labs have payment assistance to help with the cost. So that's really good. Now, next one, am I protected from genetic discrimination? Yes, you are. HIPAA guidelines, they fall in this too. HIPAA, and then there's another company called GINA for protection. GINA. So it tells you the Genetic Information Non-Discrimination Act. Well, it's called the GINA Act. I'm sorry. It protects those from getting genetic testing. So a person undergoing genetic testing cannot be denied health insurance coverage or be denied employment due to their genetic test results. Definitely. No job can refuse you because you have this history. Not at all. Does not include private insurance, life disability, long-term care. It does not apply to employers with less than 15 employees. So now you know, a lot of these businesses too, if you don't have the amount of employees you need, of course, sometimes you don't have what a bigger company has. Okay, and government employees have law similar to GINA. The military has different rules. Now, of course, you always got to find out, okay, what I'm involved with before I get involved in it. Okay, before you sign that paper to go to the Army or the Navy, it's best for you to find out what they offer you. Okay, especially with genetic testing. Okay, so there's a company called Ambry also that pays 95% of testing for genetic testing. Y'all want to write that down? You can look at this video. It's a fantastic video.
We can show it. We have time.
Okay.
25 minutes.
Yeah. And when you get a chance, look it up. I looked it up on my phone. I looked at it. It's no more than probably about 10 minutes. Okay, but it also tells you some of the things that you should know, what questions you should ask your doctor. Okay. It's
okay. No, it's not. All right, keep going. It played earlier.
It didn't play for you?
No, it's not playing now.
It's not playing now?
Let me see. No, it's not playing.
Oh, okay.
Okay.
But if I know I got it up on my phone yesterday.
Yeah.
You know what? If you don't get all of it, just put this in .com. Yeah. AmbryDemGym.com. Yes, just put the .com in there. Let's see if you could put. You want to put it up with a just the
Let's see.
.com.
All right. www.
Ambrygin, AMBRYGEN.com. AMBRYGEN.com.
No.
Still
it's
won't
not.
play?
Mm-mm.
I wonder if you didn't do the www, but usually you don't have to.
Yeah. it's
Okay,
just-
but when you get a chance, please look at it. It only takes a couple of minutes, and it will help you that when you go to the doctor, what questions you should ask them and what you should know. So where to get genetic testing? You want to go to the next?
I'm trying to. My computer's
stop?
acting up. Yep. All right, you
Okay.
can start. I'll put it up when I get it.
Okay, in New York, we all know NYU, Langle Health. Okay, that's a place, definitely NYU. You can get genetic testing from there, from, as I said, Memorial Sloan Kettering Center, Mount Sinai Hospital, and Columbia University Hospital. These are just a few. I'm sure that some of the other hospitals offer, but this is what that was given that we know that will do genetic testing there. Okay, some of the other ones for ancestries, as I said, they have another website called Truth Finder. I don't know if anyone have ever heard of that one. And Legacy Tree. Yeah, so there's a lot, but we all know that the ancestries.com and the 23 DNA and Me, those are the number ones that a lot of people have went to. Now, this is in Philadelphia, and they did Philadelphia because I think they also have, they're affiliated with some hospitals out there or colleges out there. Right. But yes, again, very important. I mean, this pretty much includes just the genetic testing. But of course, everything that I said in the first workshop, with the breast cancer, with the colorectal cancer, it all relates to genetic testing to help you find out if you are at a higher risk for those cancers and all the rest of them too. Anyone has any questions? This one was a little shorter. We still have time.
Any questions? Yeah, we can do another round of bingo. Any questions about anything that was discussed?
Today, period. Okay?
Is any of the, because you said sometimes you could do it blood, saliva, or the mouth swab. Is there anything that like specifically they prefer doing it through blood because you get a better result?
Well, I haven't been told that, but I mean, to think about it, the blood probably is the most accurate, I think so. Yes, it's coming out of your veins and arteries. You know, so that probably would be, but it's depending on, I guess, the physician. You know, just like medications, you use two different medications, but they believe in this one, they've gotten better results with this one. So it'll depend on the doctor himself. But don't feel that you can't suggest. Okay, you have a lot to say pertaining to your health. You really do. And I mean, a lot of times we hold the physicians to a higher regard, but they put on their pants just like we do. Okay? And they can make mistakes too. Okay? So that's why it's important for you to be knowledgeable about it. I said knowledge is power, and knowledge will save your life. It will save your life. But yes, we can do another.
All right. First, let's give Pam a round of applause. Yes.
Thank you.
Did she answer the questions that you needed answering today? Did she motivate you to advocate for yourself?
Indeed.
Your next appointment, have that conversation, and even if they say no, go to another doctor so that you keep going until you get the information
And if you
what
have
needed.
not, made an appointment for your mammo, please do so. Okay? Now, again, as I said, a lot of people, oh, it hurts. They squeeze my breast. Oh, my goodness. Okay? It's for a good reason. Okay? And so a couple of minutes of discomfort is worth a lifetime for you.
Mhm.
Okay, so and then find out about your other screenings too,
Mhm.
especially if you had someone in the family that has colorectal cancer. So between genetic testing and then the screening for it. Okay, a Cologuard is good, but a colonoscopy is better.
Better.
They
Yep.
can see.
Yucky. But
Okay, in
better.
1 second. And even for the endoscopy, who knows the difference? Okay, the endoscopy goes through the top. It's looking at the stomach. It's looking at the small intestines. Okay, all of it is considered the GI though. The large intestines and the colonoscopy, and down there the rectum is all in the GI system, gastrointestinal system. Okay, it's just a colonoscopy. And again, now people holler about that. Oh, I gotta drink that Go Light. It's the bottle this big. Oh my goodness. Remember, it's worth it. It's worth it. Okay, that scope has to be able to see that colon inside. It has to be clear. Okay, with feces, it's impossible to see it. Okay, it's impossible. And usually they do not have you, come back so soon because with all the Go Lightly you drank, all the electrolytes came out too. So they're not going to tell you, so soon. In 3 days, drink some more Go Lightly or in another week. Yeah, you had a question. 1 second. I'm sorry. Yes.
So soon. I had one in January and they had to redo it in February. I was not happy.
No, now see that's
not
a
too
little.
Could have been bad.
Again, I
6 months.
yeah.
Next one, no.
Yeah, so see, here we go with the doctors too,
But I had a question.
Yes.
Years ago, they told me every 10 years, like that thing up there said. When I took the last one, it was a year and a half ago, they said every 5 years. Wait. What happened to the 10 years? Is that because they saw something or found something?
They might have found something if you had polyps. Polyps can grow back. And it takes no time for them to grow back. Yes. So then they don't want to wait for 10 years. And you have a whole bunch of polyps in there at that time. And they don't want it. Yeah, so depending on what they've seen and depending on what history you have in your family, they may cut that time from 10 years to 5 years to 3 years, every 3 years. Yes.
The reason why I asked is I saw something today.
Okay, I'm going to say to you, not exactly, but when you think about it, yes, it's what you're putting in your stomach and what's coming through that colon and coming out on your rectum. So it definitely is. Just like if the meat contributes to it, then of course, okay, fermented stuff or whatever. She said if there's fermented food, it contribute to, is that what you said, right? Basically, cancer. Okay? So remember, like I said, of meat, anything that you put in there, that's why, as far as fruits and vegetables, because they have the antioxidants and the fiber to help. Now, depending on what type of GI problem you have too, you can't take in too much fiber. Okay, because if you have something like Crohn's disease or colitis that you're constantly having diarrhea, okay, you think you need more fiber? No. You don't need no more fiber. Well, I guess you will not be going out of your house. Okay, you will have that toilet right next to you. I say, I'm not going out. But of course, with any of those diseases, diagnoses, you're going to be more uncomfortable if you do it too. So don't make yourself be more uncomfortable. You had a question? I'm sorry. Okay, you're good? Yes.
Also, because I had to go to a GI, like for different people, even healthy stuff doesn't work for you because for me, they put me on a diet where I couldn't eat pitted fruits. Like my body wouldn't process natural sugars, and I felt like my stomach was going to explode. Like I couldn't eat a peach. I could not eat a plum. I couldn't eat green apples. I couldn't eat garlic. I could eat so much stuff for about a year, and then slowly I was one thing at a time, because like I put some essential.
Well, now you hear what she says. Of course, DNA, mutation of that gene that it doesn't agree with that food too, going into your system. Because see, a lot of times people don't understand that people can't eat certain fruits. You know, they're like, oh, well, fruits is healthy. Yeah, they're healthy, but they're harmful to me. Okay, I can't eat any citrus really. You know, a lot of people will love orange juice and stuff. I'll be like, ooh, the acid. That's right. The acid reflux. That thing will tear me up. Grapefruit juice, you know? Any of the citruses. I'm like, oh no, I'll pass on that one. Yeah.
Colonoscopy, get it right the first time. 'Cause usually the second time nobody
In other words, the prep.
The prep.
Yeah.
Oh,
Oh,
the prep for the colonoscopy.
I wasn't.
Going back to
okay. So, you know, he's still on the colonoscopy apparently. That go lightly and him didn't go lightly together. Okay. So he's just saying to do it right the first time, which we all know.
But it wasn't you. It wasn't.
Sometimes you do, but sometimes too, people do skim. You know, that meaning they skim that they still leave like this much in the bottom because they're so tired of going to the bathroom. Like, I drank as much as I'm going to drink. So when you say that, realize that when you go in there and they put the scope, they cannot see. Okay, they cannot see all of that. You know, we all know our stool is brown in color, so think about it. It's dark. We have put light here, but they still can't see. Okay. All righty then.
All right, so can we give her another round of applause?
Are you gonna do the raffle first?
Yeah, they went to the bathroom.
Okay.
All right, so we're gonna do the raffle, but they are going to the bathroom, so we'll wait for them to come back. What are some takeaways from today's workshop? The whole day. I know I asked for 3 in the beginning. Testing. What else? Questions. Ask questions. Inform yourself so you know what questions to ask. Good. What else?
Tell other people what you learned.
Yes, that is the important part of this workshop. Also, take whatever you learn and take it back to people. Anything else? No? All right, so what I'm going to ask you to do right now is to do the post survey. Then we're going to do the raffle. And then we're going to do another round of bingo. And then there's food and you can go. Sounds good?
Sounds good.
All right, so if you've already completed the post survey, just raise your hand. And Pascal and Sheila. Oh, and I forgot to give a shout out to Yvonne, whose brother prepared our lunch today. So, yes. And takeout trays, yes. And also, don't forget, if you're looking for a caterer, I know a lot of times you love the food that we have. Talk to Yvonne about her brother catering your event. Okay? All right, so we're waiting? Okay. All right, so we'll do a round of bingo. Everybody has their bingo card? All right. So, oh, wait. Wait, I'm sorry, you're doing a post. I'm sorry. You're doing a post. Oh, wait. Wait, first finish the post. And then. Oh. All that bonding is gone. We said thank you. Bonding time is over.
What happened?
That's so funny.
Margaret, you want to get this?
Yeah, it's not. One's probably like a Wi-Fi.
Thank you.
You're doing the bingo, though, right?
Oh.
No, not t-shirt, Diane. I see that. I see.
All right. Yes, they'll come around. Remember your number. Oh, remember your number for the raffle. Right, because if not, we also have the list in case somebody thinks it's theirs and it's not, we can verify. All right, Donna, are they still in the bathroom? No. Is everybody finished their pre and post? All right, so we'll start with the raffle, and then we'll go right to the we'll start with bingo. Sorry. All right, bingo. for your wonderful opportunity to win another bag, not a shirt. Yay? All right. B, colon cancer. B, colon cancer. Oops. Let me do this first. N, uterine cancer. N, uterine cancer.
Now, if you think you've gotten it, of course, because it may not be even, let me know. Okay.
I, exercise. I, exercise. B, thyroid cancer. B, thyroid cancer. Yep. Mm-hmm. I, radiation therapy. N, esophageal cancer. That's how quiet you're getting. Look, it's so quiet. I know. G, breast cancer. G, breast cancer. N, risks. N, risks. I, risks. B, I know I said it twice for both letters. B, BRCA2. 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 B, yes. Another B, diet. B, diet. Dun, 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 dun. Y'all quiet again? I'm going to shake it up. G, diet. All right, I'm shaking. That means you made a great board. O, stomach cancer. She doesn't even have a board. You get ready to start a fight. All right. N. No, she's joking. N, cervical cancer. N. How we doing? Somebody close? Ooh, I'm glad you don't have money on the line. I know. I, breast cancer. I, breast cancer. O, cervical cancer. O, cervical cancer. Don't leave yet. We got the raffle. I, stomach cancer. Don't forget the free space. I, colorectal cancer. I, colorectal cancer. G, genes. G for genes. G, genes. G, BRCA1. BRCA1. Y'all, really? G, bladder cancer. You get 2 bags now. O, liver cancer. O, liver. I know, wrong L. O, liver cancer. Next one. Somebody's in the bathroom. G, I think so. Oh, Yvonne. G, BRCA1. They're in there multiple times because there are multiple places on the board. G, BRCA1. No? I'm hearing things? All right. G, prostate cancer. G, prostate cancer. I know. Oh, this is why. Oh, let me pin the right letter if I get the right letter. No. G, lung cancer. G, lung cancer. How we doing? Missing one? All right. O, pancreatic cancer. Oh, the fun's over. They're like, oh. Don't forget Raffles next. N, prostate cancer. Prostate, N. G, close, liver. G, liver cancer. G, liver cancer. G, lung cancer. G, lung. I can't even see the letters. N. Huh? No, they're multiple. N, abnormal cells. N, abnormal cells. N, colon cancer. N, colon cancer. We'll do two more and then we'll do the most. N, colon cancer. How close are we? G, breast cancer. All right, let's see. You're going to do our bingo cards. N. Oh, wait, hold on. I said N first. N. Hereditary. Yay! Woo, woo, woo. Yay! We'll trust you at this point.
Only one I got. One.
Congratulations. Congratulations. All right, now raffle time. So what I'm going to ask you to do is the bingo cards, if you did not write on them, please put them in the center of the table. All the little breast cancer ribbons, put them on the side, and the little eyes you can put on the other side. It'll be easier for us to collect. Now, did everybody get their little takeaway? Do you like? Yes. You're welcome. All right. Raffle. Remember your numbers. Are we ready?
Ready.
I'll give you a minute. Number. Damn, I had bad luck with the bingo. Go ahead. Number two. Yay! Congratulations, $25 gift card. And the last one goes to
22 again.
You got the first time?
Yeah, 22 was the count before. So give another prize.
Oh, it's not the same. No, she said she had 20. Oh,
it's a different number for her.
so wait, you had 20. You had 22 before. Okay. Latoya, congrats. All right. So with that, thank you for coming. Thank you for participating. We hope that this was very informative to you. And you know, Arisha, we do a lot of different things. All right. Don't forget to look at our classes. We have Juneteenth. We have a line dance workshop, classic soul line dance workshop at the Y. It's going to be on June 14th, I think. June 14th. Plus, we have our walking group. Plus, we have our health education. Don't forget health education. If you thought what you heard today was great, come take our class. All right, every month. Picture. We're gonna do one group picture. No, you get to keep the pen. Everything we gave you today, you get to keep. So we're gonna do. With this as the background. Where do you want it? There or what?
If anyone wants the hands out on the table for breast cancer, location. examinations, you can take that with you. Those you can take with you. Okay, self-examination, take that with you.
Okay, even if we move the tables? If we move the tables, we're looking to have the PowerPoint in the background. Let me see. Yeah, we're going to see if we can push this table out, and if we do the picture here, if there's enough room for everyone. And don't forget, take food. Don't forget oh, you got it already. We'll put it over. Somebody's phone, don't forget it. And there was still a chair with winner on it. Just saying. We only found 2. All right, so we're going to try to do the picture here. No, I'm going to take it out. So this is the bag. Come on. Picture first, and you can grab whatever food you want. All right, so we're going to face this way. Is it enough light? Focus this way?
Yeah, this way.
Where's Pam? Pam? We're not in the light.
Oh wait, no more people coming.
There's none of the front.
You know you do. I can't see this. Can you see Shelby? You can see her. You still see her? Yeah.
I can see them.
So I need some sliding. I get down there, I can't get up.
All right, where my knee situated? I know. Y'all got a few minutes.
Oh, yeah, look so beautiful. So much. Okay.
Okay. That's you.
Young knees.
Oh, come on, let's go.
You guys are so silent.
Let's sign off.
Yes.
Let's sign off. Feel like a little goodbye.
Well, thank you everybody for coming out. This was a very successful workshop. And I thank Hunter and everybody that was involved for having me do this presentation.
She did a great job.
Thank you so much. Thank you for coming.
Thank you.